Hi, everybody. We will start shortly. A few more minutes to solve some technical issues that we've encountered this morning. So just a few more seconds or minutes. Again, just a few more minutes to try and solve some technical issues that we've encountered this morning. So I know a lot of people have already joined us today. So I think 1 or 2 more minutes will take us before we actually start the webinar. Okay, everybody, so welcome to our third webinar. Just before we start, few things to cover. First of all, I'm sorry, I don't know if you can see me as well as the presentation today. So if someone could comment on that, that would be great, because I cannot see myself today for some reason. So that would be nice and great help. If you can hear me, raise your hand. Yes, can see both. Okay, thank you. So no more comments needed. You can see me and the presentation. So we got that thing covered. Thank you, Nicola. And you can hear me as well, right? Perfect. So let's start our topic of the day. So today we're actually discussing one of our most familiar oh, just another thing to say before we're actually starting the webinar. Normally, I have some help from Judy, who's behind the scenes and is reading the questions to me as we go along. We have some issues on that. We have some technical difficulties with that as well today. So until we solve that, I will try and see the answers at the questions at the end of the session. So just before moving on to the hands-on part of the Forma and the Plus, I will look at the questions. It's not that we're ignoring you, it's just that it's some technical issues that we need to solve. So I will do like later on Q&A question, but you're welcome to ask them as we go along, and I will see the questions later on. Yeah, okay, so again, handout, you have the QRG for the Forma, the Plus, the body effects and mini effects on PDF versions on the right hand side. You can download them. You have the presentation that I'm using today also on a PDF format that you can use today. You can download. You have all pictures and everything is up there, so you can absolutely use it for whatever you need. And let's start. So the Forma and the Plus are non-surgical radiofrequency treatment for wrinkles. That's very, very general. Let's talk about, well, the screens we've seen already, so let's continue here. We kind of covered what is RF on our last webinar, but since it's not necessarily the same people who've attended the Morpheus 8 and Fractora, I will repeat that. So RF is part of the electromagnetic spectrum. And the band that we're allowed to use, the frequencies that we're allowed to use depends on the band allocation for different industries. So there's a huge table. It's very, very easy to see that table over Google. If you just look at it, Google radio frequency allocation bands per industry, you can see that. So you have each industry may use very, very specific bands, very, very specific industries, frequencies, sorry, for radio frequency, like submarines, airplanes, television broadcasting, etc. In medicine, the frequency range that we're allowed to use, the allocated range is between 100 kilohertz and 6 megahertz. And of course, what I kind of skipped, but it's very, very important that RF is at its very essential being is just an electrical current, okay? And it behaves like an electrical current. More specifically, the frequency that we're using in InMode is 1 megahertz. Okay, and the reason we chose 1 megahertz and nothing else in between that 100 kilohertz and 6 megahertz is because at lower frequencies, what we see and receive is actually nerve stimulation, and we're not looking to do that. And at higher frequencies, we get more radiation and less localized RF, and we're definitely not looking to do that as well. So at 1 megahertz, we're achieving the exact stimulation to the tissue that we're looking for, and enabling us to work on the tissue in a way that is beneficial for our patient. So RF, what we're electrical current, basically, what we're using here is conductive RF, meaning depending on contact with skins. And this is, as I said on the previous webinar, on the Morpheus webinar, conductive RF, I kind of want to take a minute here and delay, because this is super important for us, as this actually determines the quality of the treatment. So our treatment completely depends on contact of the applicator, of the electrodes on the applicator with the skin of the patient. Okay, so contact RF, full contact with the skin is super important, and we will see it as we go along. Generally speaking, we're talking about two types of conductive RF. So it can be bipolar and monopolar. Monopolar meaning only one pole, because if I take you back one slide, we talked about electrical current. Electrical current knows how to flow from a positive end to a negative end, okay? And it will always look for the easiest, shortest way to do that, so less resistant. RF, monopolar RF, basically one pole is the applicator. Applicator contains one electrode, and then the other pole, the negative or receiving pole, normally the patient sits on it, lie on it, holds it, something like that, in order to close a circuit, an electrical circuit. It goes deep, but we don't know how deep it goes, and we cannot control exactly where it does its majority of the work in the body, because the current flows in the way, as we said earlier, that it's easiest for the current to flow. Okay, so it's not in our control. So let's say if I'm applying the applicator to the face and the patient sits on it, then theoretically most of the work can be concentrated on my shoulder. It's not exactly what happens, but theoretically it may be the situation. With bipolar RF, both of the poles, both of the electrodes are actually located on the applicator, as we actually see with very clearly with our Formind Plus and Body Effects and Mini Effects applicators. Okay, so both of the poles are located on the electrodes, and this does two things. First of all, enables us to close the circuit in a very defined way, which means that we can control the depth of penetration. Okay, so very general speaking. Just a second. Okay, back with you. So two electrodes, two poles on the. I'm just getting back into the thought where I was before. We can control the depth of penetration. Okay, so a thumb rule with regards to bipolar RF and depth of penetration. The depth of penetration is half the distance between the electrodes. Okay, and this is a thumb rule. It can be slightly less or slightly more, but this is general notion with bipolar RF. So we can control it, meaning we actually can design a handpiece to our needs that would be more suitable for face and more suitable for body. And that's actually what we do. Okay. Second is that it is not just working wherever in the body. Okay. So so all of our applicators, RF-based applicators, are bipolar applicators and behave that way. So patient does not have to sit, hold, lay on anything else, any other electrode. Continuing. Yeah, mechanism of therapy. So very similar to what we've seen before. Okay, so it's actually the same. Electrical current conducted through the tissue increases the movement of the ions in the tissue, and they're actually collide with each other. This kinetic energy is then transformed into thermal energy that creates heat, basically. And this heat causes control damage, and control damage should be kind of underlined here, okay? This control damage is what we're looking for in order to renew the tissue, because renewal always comes from some sort of damaging to the tissue. This control damage triggers the natural immune system, the local immune system of the body to take action, and that's where we actually see neocollagenesis, neoelastogenesis, some production of hyaluronic acid, and generally speaking, we see a tighter looking skin, younger looking skin. As I said before, and I will say it again today, contraindication, and I will not read you through the contraindication, okay? So all contraindication should be read by therapists. If you're a therapist, I don't know exactly who is with us today, okay? So if you're a trainer or a therapist or an end user of some sort, a doctor, whatever you are, it is super important that you read through the contraindication. You know that that they exist, and you make sure that your doctor is aware of it and your patient is aware of it. Patient should be signing an informed consent form prior to the treatment, saying that you're not suffering any of the contraindication, and that's where you can start the treatment, okay? I do take a minute again, as I did with the Morpheus, to talk about implants, silicone implants, and fillers, because this is because of what we do here, okay? We work on the facial areas and stuff like that. So over silicone, we're not treating at all, ever. Over fillers, I recommend not treating over fillers because we do actually penetrate relatively not too deep into the tissue, just the right amount of depth in order to work on the dermal layer. But since we are working on the dermal layer and we're hitting it to quite an efficient extent, I recommend do not apply Forma Plus applicators on areas that were injected with fillers. Botox is not a problem because after it binds, okay? So take a safe timing gap, and 2 weeks post Botox injection, you can go ahead and treat your patients. If you're looking to combine treatments, then I recommend give the RF treatment, then inject fillers. And that's it about the contraindication and the fillers and RF. Okay, so read through it, make sure your patient are aware of the contraindications and that they sign the form. A little bit about the concept and the indications of the Forma and the Plus. Now, the way that it will be divided today, I'm going to talk about the Forma and the Plus applicator, which are very, very similar. Only one is designed to work on face, and which is the Forma, and the Plus is designed to work on the body. We will do a short hands-on session afterwards, and then after this, we will move on to the body effects and mini effects. Okay, so yeah. Concept and indications for Forma and Plus are the idea is non-ablative skin tightening. So when talking about the face, we're talking a mini facelift that treats skin laxity and wrinkles. When talking about the body, we're talking about lax, low-fat areas like arms, navel, knees, and inner thighs. A little bit of cellulite may be targeted, but I think if this is the main issue of today, then let's talk about the body effects because it's more efficient there. So how about the technology? The idea of the Forma and the Plus is that we have, and this is something that is super unique to InMode, and is I kind of want to take the stage here today and explain it very, very well, because I think for next week webinar, when we're talking about the Evolve and Evoke, this is actually the basics that the Evolve and Evoke are designed on. So if we understand this, then our job next week to cover the Evolve and Evoke will be much, much easier. So constant temperature monitoring, epidermal temperature monitoring, is something that is very, very unique to InMode, because we do it very efficiently and very accurately. This is something that is very, very important in order to prevent skin damage, epidermal damage, and burning while working at the highest possible temperature. So we have what we call the RF cutoff temperature. And the idea is that you as an operator can actually determine the working temperature, anything between, according to our recommendation, anything between 38 to 43. With regards to Plus and Forma, if you ask me, there is no reason whatsoever to work at anything less than 43. You can always work at the maximum cutoff temperature with these two applicators, because they're super nice and easy on your patient and for you as a therapist. It feels, patients describe it as a hot stone massage, and when you know that you're not harming your patient, then it's easier to deliver the treatment in an easy way as well. Okay, so we're adjusting the cutoff temperature based on what we need. Okay, so the highest generally the better, but it has to be tolerable by the patient. What does it mean, the cutoff temperature? So the cutoff temperature concept, first of all, we talked about constant temperature monitoring. So we're saying there is a temperature sensor embedded in the central electrode. Okay, so there is a constant monitoring, and you see the feedback, you see the exact temperature showed on the screen. Additionally, you can hear an audible signal that lets you know whereabouts you are. Okay, so at the rising temperature phase, we hear a beeping sound every second. At the when approaching the cutoff temperature, let's say I have set the cutoff on 43 Celsius degrees. When approaching it, I will be the beeping sound will double the speed, so it'll be twice per second. Okay, so, and that would be 2 Celsius degrees below the cutoff temperature, so at 41 in our case. And at the cutoff temperature, when I've actually reached 43, what happens is that I get a triple sound, and additionally, the system cuts off the RF, hence cutoff temperature. Okay, so at this point where the temperature sensor reads 43, there's an immediate feedback to the system. System shuts the RF, and that prevents us as therapists from overheating the tissue and causing damage. And this is super, super important, because this is what saves you from accidental adverse events, and what makes this treatment to be so effective while being so safe. It's practically impossible to cause any damages if you're working correctly. Contact monitoring, we've actually discussed that. So in case, another thing that happens in case with regards to that monitoring is the fact that we're actually monitoring the degree of contact of the handpiece. So once contact is lost, you also get an audible sound showing you that. Okay, unfortunately today with the hands-on part, normally I do show that. Unfortunately today with our patient of the day, the only sound you'll be able to hear is that bad contact, bad coupling sound, and you will not be able to hear the actual audible signal with regards to the temperature, but you'll be able to play with your hand, with the applicators in your offices, and see and hear that as well. So this is what we've talked about with the bipolar RF. We have a central electrode and 2 side electrodes. Okay, in the case of InMode, this is something also that is quite unique for us. We're talking about alternating currents. So as soon as we've delivered the RF, as soon as it leaves the central electrode, it starts bouncing back and forth on both sides. Okay. Additionally, we have anti-arcing mechanism here, and a lot of safety features that helps you provide the safest treatment and most effective. So what are the formal indications of the 2 applicators? Forma is the loose and wrinkly skin of the face and neck, and the plus is indicated for the treatment of loose and wrinkly skin on small body areas like navel, arms, and knees. And as RF is colorblind, we can actually treat all skin types, 1 to 6 Fitzpatrick. Okay, and this is how it looks like with regards to temperature control. Okay, so we talked about epidermal monitoring, epidermal temperature monitoring, high and low impedance with the help of contact sensors that are embedded in the central electrode. This is basically just showing what we've discussed about earlier, and maintaining an optimal temperature but non-ablative. Okay, so this is all done on the surface of the skin, so there's no penetration of needles even, unlike with the Morpheus and Proctora that we did previously. Okay, the result eventually is improved skin texture, production of new collagen fibers, and new elastin fibers and new ground substance for the extracellular matrix that eventually results in a thicker dermal layer. And again, another demonstration on how the current flows. So if we're talking about non-ablative subdermal heating, we see the current flows back, and as we said, it's an alternating current, so it goes back and forth. And we talked about the depth of penetration. So the thumb rule, talking about the fact that it's approximately half the distance between the two electrodes. So if I take this pole and this pole, that would be half the distance between the electrode. Okay, so this is more or less the idea. A short video animating exactly how it's done in our body. Okay, so a little bit of pre-treatment consideration. I was muted here by Judy. I don't know why. I think she wasn't happy with my performance today. So pre-treatment considerations. Okay, so again, I'm not about to read through that, but what we want to make sure is that the skin is not irritated. Okay, so any irritants that are used daily by our patients should be ceased prior to the treatment. Although we said we don't have a problem with different skin types, we don't want to treat super tan skin because a super tan skin is an irritated skin. Okay, so we don't want to do that. We don't. It's an already overheated skin, and we don't want to treat that. So that's one thing. We're asking patients to arrive with clean skin. If they don't, then we just clean their skins. Okay, so prior to treatment, I make sure to remove all makeup, all lotions and all, and I kind of dry up the skin late afterwards with rubbing alcohol. Okay, so 70% medical grade alcohol, and this is just good practice, and also helps us to prevent cross contaminations and infections, which is super cool nowadays to prevent these kind of things. Yeah, so another thing, well, here it says before each treatment clean your applicator. If you ask me, it's better practice to do that after every treatment. So immediately after every treatment, I clean my applicators from all gel remnants and wipe it with alcohol. But if it's a big clinic, it's also good practice to say, if you have different therapists using your system and applicators, it's a good practice to instruct your therapists to just wipe it with alcohol prior to the treatment. That should be done on standby mode, of course. And generally speaking, I think with all of our treatments, even hair removal, before and after pictures, okay? And it's super important is this one because it's a relatively mild treatment, but results are shown very good. But sometimes if there's no baseline to compare to, then patients are like, well, I don't see a difference. Once you put a before and after picture, one's next switch to another, they're all happy about it. And again, our job is to make them happy, so let's make them happy. Okay, about the treatment. So here's the screen. I think we will talk about that more specifically when we're actually working with the system in few minutes. We do have to choose the format or the plus. Okay, so make sure you're working with the right applicator. Cutoff temperature is as we discussed before. Here on the right hand side, what I do want to discuss now is you have the temperature measurements. Okay, the online monitoring temperature. So as soon as the handpiece is connected, you'd actually be able to see a temperature that is being measured. Okay, and what I normally do to make sure that this works perfectly and to show my during my training, I put my hand on the applicator and just make sure that it reacts immediately, because it reads it within less than a second. Okay, and the treatment time, as well as we've discussed before, I really like these options of counter reset, pulse counting, and treatment time counting, because it gives me an idea of how much energy I've invested into an area. Okay, so the treatment time here is calculated as an effective treatment time. Okay, so it doesn't actually start counting it from the very beginning, but it starts at 2 Celsius degrees below the cutoff temperature when we're actually doing some work, some physiological work in the tissue. Here are parameters for forma. So I'm showing two tables. One is for the forma and one is for the plus. For the forma, we have, I will show it later on in the presentation. We recommend to divide the face into treatment zones, okay? So the one thing about this handpiece is that it takes time, but if you take that time and if you put it into your patient's treatment zone, you'll get magnificent results, okay? So it's super important that you do follow these instructions of dividing it into zones. And once you do, and applying long enough treatment to each treatment zone. Once you do that, you're almost guaranteed a super happy patient. With regards to RF energy levels, I think for most areas with the Forma handpiece, it is safe to say you can use an energy level of 40. There are some incidents where, or some cases where I recommend changing it. We'll get there on the hands-on part, okay? Cutoff temperature, as I said earlier, on my opinion, for both the Forma and the Plus applicator, always work at 43. This is an easy massage on the easy treatment on the patient. It's not painful. It feels like hot stone massage, and at the ranges that we enable you to work, 43 is the maximum. It's safe and the most effective. And gel, we're always using, for both of these applicator, Forma and Plus, we're using ultrasound gel. Clear, plain ultrasound gel, Parker's is recommended, okay? Not scented, not oil-based, not anything like that, okay? So just ultrasound gel. Same goes for Plus applicator for body treatment areas, okay? The only difference here is that we're not dividing it anatomically, but we're dividing it kind of based on size. So we have two sizes, two recommended sizes, either 12 on 12 or 8 on 8, depending on what? Depending on your patient needs and body sizes, okay? So of course, it'll be easier for me to heat up a smaller area. So also on the face, if I'll be working, for example, on a full cheek, instead of dividing it into two zones as we recommend, and you'll soon see the diagram. If we're working on a too large area, it will take me too long to reach the cutoff temperature, or sometimes I will not be able to do that at all if working on larger areas than recommended here in the table, okay? So just follow these instructions and you're golden. Here are the diagrams showing the facial different divisions. Personally, I prefer the upper one, the upper recommendation. It feels more anatomically correct, if you know what I mean. It feels right for the face to kind of work this way rather than this way. It feels like the direction by which I want to create the effect. So I like this division. Pay attention. We're dividing the cheek, including the chin, into two areas. Also, the forehead is divided into two, and the neck also is divided into four, maybe even six if you're considering this part as well. Okay. So depending on your patient's size, naturally we have smaller and larger people. You're gonna have to adjust it. Just make sure that the temperature does get to that cutoff. If it doesn't, then we need to consider reducing the size of the treatment zone. We're applying ultrasound gel. Now, I know there might have been some recommendations in the past or something like that, maybe to apply a little bit of gel on the applicator and then preheat it. Please don't do that ever, ever, ever. This is you'll be on your way to disaster, okay? Because the applicator needs to have that feedback from the skin. So we talked about contact RF, okay? It does not need to contact the gel, it needs to contact the skin. So no preheating of the gel is allowed if you ask us, okay? Therefore, I'm applying ultrasound gel on the face. Now, when applying ultrasound gel on the face, if let's say I'm working on treatment zone 1, I apply the gel on the zone and I'd apply it also on the adjacent zone. Why? because in case I'm going to have to use some more gel during the treatment, because we said it's a little bit of time consuming treatment, and if I'm working 10 minutes or 15 minutes over a treatment zone, I might be left with no gel, and it will be, I will feel it during my treatment. I will feel like the movement is becoming stiffer, not as smooth as was before, and I would need to add gel. If I will add gel straight from the bottle, it will be cold. If I will add gel from an adjacent area, it would already be at the temperature of the skin. So it would still take me a few seconds to heat it up again to the cutoff temperature, but not as much as it would if I would take it from the bottle. Okay, so it kind of saves me few minutes or seconds, and it's nice. As we said, full contact is super important, and we're making sure that we get full contact with the application of a little bit of pressure, and slow movement back and forth in the treatment zone. I will show it to you. I will show it to you on the hands-on part. Okay. The idea is we want to reach the cutoff temperature and maintain it for as long as possible. Okay. A minimum of 10 minutes per treatment zone is a must. If you treat less than 10 minutes, you will not be getting the results you want to get. Now, I understand it is time consuming, and if we're talking about full facial, then 10 minutes is 60 minutes treatment for face. And this is just something that you have to understand. We do offer shorter treatments like the Morpheus. Okay, Morpheus, we said full facial should take 15-20 minutes tops, but it is more painful. No patient want to undergo this kind of treatment. Some patients are afraid of the needles, etc., etc. Okay, so for patients who are looking for mild treatment and are willing to oblige with the times and all, this is a very, very nice and good treatment, and shows great result. By the way, we can also combine treatment very easily. We'll talk about that. Okay. And to me, again, for any cutoff temperature that is below 41, we have to compensate with additional treatment time. Well, actually, I think the longer the treatment, the better the results. That's A. And B, as I said twice already, with regards to 4-man plus, no reason to work at anything less than 43 with the help of good technique. Okay, so a little bit about post-treatment care and scheduling of the treatment. So immediately after, we see transient erythema and edema, which are nice and very, very transient. So several minutes, few hours tops, and that subsides. At least the erythema, edema may stay slightly longer. What we don't recommend is cooling down the skin. We kind of want the residual heat to do a little bit of work as well. Moisturizing the area is possible and recommended. Sunscreen always advisable, and makeup may be applied at the same day when we're treating body areas. And these recommendations and treatment techniques are applicable for both Forma and Plus. So I think we're just about to see some before and after pictures. Oh, treatment schedule. Okay, so we're talking about 1 session per week for at least 6 sessions, if you ask me. This would be the gold standard for this treatment. So 1 session per week. Of course, the older the patient, the more difficult the indication, then we might need longer treatment or more sessions. Possibly, and we call it, that's what we call mega sessions. You can also, this is especially for bigger countries, patients traveling from the far, or patients who just are not willing to give away any more of their time for whatever reason. So mega sessions are a possibility, and the idea is instead of 15 minutes per zone, you work 30 minutes per zone, per small zone. Okay, so 30 minutes per zone, 30 minutes, 30 minutes, 30 minutes, 30 minutes. That's 2 hours treatment just on the cheeks. And then instead of 6 sessions, you can see them every 2 weeks or every 3 weeks, but just for 3 sessions, 3 or 4 sessions. So it's a give and take. With regards to maintenance, again, depending on the age of your patient, depending on their lifestyle and needs and what was the indication, maybe provide after finishing up that initial serious treatment, we can provide the maintenance treatment once every 1 to 3 months, depending on the needs. Okay, so an older patient that arrived too late might need higher maintenance. A young patient that came in for just, I see a little bit of falling down and I'm not happy with, like, suddenly well, that patient after 6 sessions, we might be able to see her just once every 3 months. And a little bit before and after pictures. So here you see very, very nice results on the neck area. And again, I remind you, we're talking about RF treatments that are colorblind. So the thing is, we're always talking about relatively numerous treatments, okay? And we just have to make sure that our patients are aware of the fact that they're going to have to undergo a series of treatments. So once we make sure that our patients are aware of what is expected from them and the compliance that we need from them, because if they're going to start, well, I cannot, if we don't have compliance, then this might not be the right treatment. We have to have full compliance with the patient. Okay, and then we get super amazing results, as we said earlier. Okay, look at the nasolabial area, only 4 treatments. And that's where I let myself a little bit of rest. Look at that. Look at the submental area. Amazing treatments. Amazing results, sorry. And this goes on and on and on in body as well. Okay, so I will flick through it so you can see some body treatments as well. This is something that is very, now again, I'm not at the moment, I'm not very much aware of who exactly is the audience, but I know this is something that is very, very sick for in the Far East. Okay, so the V shape for the face, this is an amazing applicator that would give you exactly what you want. Okay, that after you see that immediately after a single session, of course the results would not stay for much longer if you give a single session. If you want the results to stay longer, you're going to have to perform the full series as we recommended a minute ago. But it gives patients exactly what they want. It gives this appearance. Okay, again and again and again. Now this is actually something that I like doing during my hands-on part, and today, unfortunately, since we're working with Lisa instead of a real life patient, I will be slightly debilitated. I won't be able to demonstrate it, but what I normally do is I normally show half face, what I call split face. Okay, so what I do is kind of give the treatment. I treat half the face, and then I let my patient sit up and look at the difference, and they see this this V shape. Okay, they see it immediately. There is one side of the face that is all facing, like is lifted, and the other side of the face is still okay. That's what I came here to take care of, and they see it immediately, and that's already making them happy. So this is something I recommend, especially if you for some reason did not take before and after pictures, because there's only one before. After you can always take. So in case you didn't do that, this is a very, very good way of showing your patient exactly what it is that we're doing. Okay, look at that. This is life-changing for that patient. Super cool results. And as I said, it is also possible to combine treatments if we're talking about Fractora or Morpheus in the Forma and the Plus. If you ask me a good way for combination, and I'm not sure it actually shows a protocol here. Okay, here we have a nice protocol of combination. Okay, so we have Forma and Fractora treatments. So 8 weekly Forma sessions followed by 2 Fractora treatments at 6 weeks interval. That's one way to do that. There's also a possibility to work with the Forma and the Fractora or Morpheus on the same day, and then on the following week just the Forma. And so every month or so you're just giving. So on week 1 I give Forma and Morpheus. Then on week 2, 3 I give only Forma treatments. On week 4 I can deliver the combination again. On week 5 and 6 I would only give Forma treatment, and then I'll finalize it with the combination as well. For example, this is for the more difficult indications. Yeah, again, combination, one Forma treatment, one high energy Fructora treatment, showing super amazing results. And again, here is a combination of actually 3 applicators, so Forma, Lumecca, and Fructora. Okay, so I think this is what is one of the cool things about InMode. So if you have the platform that supports all technologies, the full platform, you can actually take years of a patient's face, and this is super cool. You don't have to choose one or another. It's not a system that only gives you light based. It's not a system that only gives you RF based. It's a system that can do everything, and if you know how to use it right, then you and your patient can benefit a lot out of it. Yeah, well, not gonna summarize that, but let's see some questions, okay?
We have a question from our friend Dr. Pandit from India.
Yeah.
He's asking, what is your time of duration for full face and neck? Like 60 minutes, 70 minutes?
I think it really depends. If you're discussing about treatment time, it really depends on your patient age and needs and indication and size, treatment area size. Let's say the shortest possible way would be 10 minutes per zone. So 10, 10, 10, 10. That's already 40 minutes. Additional 20 minutes on the forehead, that's 60 minutes. And we have at least 4 zones here. That's another 40 minutes. So the minimum recommended time for Forma treatment, facial and neck treatment would be 1 hour and 40 minutes. That would be the minimum.
We have a few questions also about fillers and Botox. Does it damage the fillers?
There is a possibility that it might damage the fillers. We did not study that. We did not test that. And we do heat up the tissue quite extensively. So don't do that.
Okay. We have a question from Sonia asking, can Forma be used to slightly contour the side of the nose? For example, you mentioned that it can contour the chin for the V shape. Can you use it on the sides of the nose to make a slimmer appearance for the nose?
I haven't tested it, and I don't have a good enough answer, but I think what it would do is it would tighten the skin. Okay, so if I'm thinking about, I didn't do it myself, but if I want to take one step back and think about what we're doing in the body, we're actually we're working to tighten up the skin. So it would tighten up the skin of the nose as well. I don't know if it would shrink it to the extent that you're looking for or your patient looks for, but it might do some help. By the way, about this, I did talk to a doctor who said that applying Fructora and Morpheus treatment actually helps with shrinkage of the tissue, the soft tissue in the nose. So you may try that or combination.
Another question, can Forma be used for mild acne to help heal the lesions?
For mild acne, I would not heat up the tissue so much with the Forma, but what I would do, I would use the Fructora. Fructora and Morpheus are super beneficial for active acne patients. So this is what I would choose, would be my go-to.
If the neck is full of fat and loose skin, would you recommend to use Forma or Morpheus?
So depending is, I think we have to understand what it is we're looking to treat. If we're looking to treat double chin, then maybe we may get some improvement with the Forma, but we get, and we'll cover that in our next part of the session today. We may get better results with the mini effects working on this area, because the mini effect actually targets fat cells and breaks them down. So if we're looking to break down fat cells and rid of fat tissue, fat layers, then we might want to use that applicator. If you don't have it, then extensive work in the neck using Forma and Morpheus may be beneficial for that kind of patient. Damages silicone implants, like breast implants. We're not treating okay, this is a good question that has to be covered and thoroughly. As I said earlier, any silicone implants injections, whenever silicone is involved, we're not. Okay, we don't like any possibility of causing leakage of silicone into the body. It is super risky. There are many generations of silicone implants and injections, and these patients, these areas are banned. Okay, so no treating over silicone. What else?
Can you do forma on bony areas like the forehead?
Absolutely, no problem doing performing forma treatments over bony areas like the forehead, like the zygomatic arch, like the décolleté, dorsal part of the head. By the way, super cool if you combine that with Lumeka for older people, because this area, the dorsal part of the hand, is an area that actually gives a very old appearance to people because it gets solar pigmentation and it gets wrinkly. So you take both of these indications with the Lumeka and the Forma, you get magnificent results. Highly recommended. Try it. So yeah, you can treat bony areas. You just have to make sure that you're maintaining good enough contact because that's the limiting factor. Okay, so you're gonna have. We'll discuss that shortly on the hands-on part. Okay, we have another person.
Yeah, we have another question. Do we work in single mode in any specific situation, or we always have to be on a repeated mode?
Okay, so this is I recommend to always work on repeat mode. The repeat mode enables us to work continuously. The single mode actually makes you requires you to repress the foot pedal again and again and again every 30 seconds. Okay, and this is just more laborious for you, and it makes no sense. It's there for historical reasons. You kind of ignore it now. Okay, so work on continuous mode always. There's just a second, Judy, because there's something that we've missed here. Will this control damage create a biological cost to the tissue? What about the telomere shortening? No. We're not getting any irreversible damage done with the help of the Forma. Okay, we're talking about only thermal effect to the tissue. Okay, no effect on telomere shortenings and stuff like that you have to be worried about. Okay, the idea is that the heat actually targets fibroblasts. It triggers them to proliferate and to create more collagen and elastin. This is what actually happens in the body. We have some histologies showing that. There are some articles. If you're interested in it, you're welcome to go into the InMode Resource Center and download all articles that we have. All studies that we performed on our applicators are there. If you're struggling with that, you can also contact us and we'll help you with that. We'll be happy to share these studies with you. Okay, so these are all backed up with technology, with studies. Sorry. Anything else before moving on to
we have some question about the skin type. Can we use on all skin types?
Yeah, all skin.
Dr. Vikram from India, hello, how are you? For eyelid bag treatment, is asking if Forma is good for eyelid bags.
I don't know. It will tighten the skin over the area. Okay, it might not solve the issue completely, but it may improve it because it will tighten the skin and it will be more stretched over it. So that would be it. Yeah. Okay. Can the Forma be used on slightly to the side of the nose? Oh, you asked that. Another thing, which price would you recommend? Cannot answer that. That depends on the market. The markets are so now. When we're talking about webinars, especially, we have people from all over the world watching us now, and it's impossible for me to recommend pricing for you have to see and what people really pay for this kind of session. So sorry. Yeah.
Any specific movement pattern?
Any specific pattern?
Movement pattern.
Yeah, we'll have that during the hands-on minute, okay? How long it will take to treat the navel area, depending on the size of your patient, okay? Larger patient needs longer treatment. If it's a relatively smaller patient, maybe only two treatment zones can be treated, so 8 on 8 or 12 on 12, only 2 areas per abdomen, and you can finish it up with 30 minutes, which is not too long at all. Let's see, what else? How would you divide the navel here? Again, depending on my patient size, I think we'll keep that to the hands-on part, okay, in a few seconds. If the neck is full of fat, we've discussed. Can you do form on bony areas? Yes. All skin types? Yes. Eyelid bag, filler, specific movement. Okay, so let's move on to the hands-on part. Okay, and this will cover in a second. So I will stop sharing the screen for a second, and I will switch you to the treatment bed. ده مخوبانة في لوكسات. كانت خبنيتها. Okay. Okay, so as always, I will try and demonstrate a treatment that is as close as possible to real-life treatments. Okay, I will start with the Forma applicator. I will put them one next to another for you guys to see the two different applicators. Okay, so Forma, the smaller one, and Plus, the bigger one. Facial treatments, facial and neck treatments, and body treatments. Okay, don't attempt to treat face with a Plus applicator, because you'll end up hurting your patient and causing some adverse events. Remember, it also have an effect on the depth of penetration. So before actually starting the treatment, what I want to do is clean up my patient's skin. Okay, so I'm going to glove up and start working. Actually, what I did show you guys before, and I said I like doing that because okay, sorry. I kind of want you to look at the skin temperature here. If you can see it, I don't know. Just a second. We'll make sure that you can. Okay, so we talked about okay, so you see the temperature measured in the room now is 21.2 Celsius degrees, and as soon as I apply the applicator onto my hand, it rises. So you see a very, very immediate reading and accurate. Okay, so it means that this is working, and I can start my. So the first thing I want to do is I want to clean up my patient. I've asked her before she does not have any of the contraindications, no implants, no, just breathing as you can see, as is. Okay. Now, because we were struggling removing the pretend pigmentation, I will not draw on her at the moment because I don't want to ruin her face completely. But the right thing to do, especially if you're a beginner, would be to draw a line from the lip towards that side here, okay? And to mark your treatment zone. I want to make sure that you're working on a very defined treatment zone. So as I said, we have two types of division for zones. We can do either that way or dividing it that way. Personally, I feel this is more physiological, more anatomically correct. So that's what I will do. I will not demonstrate in marking her. because it will damage her. So forgive me for not doing that. Next thing I do is I want to set the parameters. Okay, so if we'll go back to the screen, sorry for that, for being all over. We talked about the need to make sure that we're working with the correct applicator. Okay, so theoretically, the class 1 can be the class applicator could be chosen at the moment, but that would mean that I'm not working at the energy concentration that I think I do. Okay, because the class, the format is connected and the plus is indicated on the screen, then I actually have double the amount of the energy. Okay, because I'm working with a much smaller applicator than I think that I do. Okay, so just make sure that you work with the right applicator. So I'm working with the format. As I said before, if you ask me, energy levels should always be around 40, and soon I will discuss with you what happens if the patient is uncomfortable. Okay, so for both format and plus, I recommend an energy level of 40. Normally, all patients can tolerate that. And a cutoff temperature, as we said before, a maximum of 43 for these two applicators. And pulse mode, as you asked, should always be set on repeat. Not single, because single just makes me have to repress the pedal every 30 seconds, and it just makes no sense. Once I'm ready, I can press the standby mode, but I kind of, well, I'm not going to do that today in order to not melt down Lisa. Okay, so you'll have to forgive me, but I kind of wait before I do that once I'm ready. So yeah, we can move back to Lisa now, I think. Hopefully. And using ultrasound gel. And I want to apply some gel on my patient. Yeah. Especially because I'm about to give a relatively long treatment now. It is very important for me to make sure that I'm comfortable. Okay, I'm kind of, I know a lot of, especially new therapists, don't fully appreciate the need of them being comfortable. So make sure that you're comfortable. If you're more comfortable standing, do that. Give treatment standing up. If you're more comfortable sitting down, then do that. It is crucial for a good treatment as well. And what I do just before starting the treatment is I spread the gel over the treatment area. And as I said, I apply a little bit of gel on adjacent area as well. And you remember that is my treatment zone. I'm going to treat the lower half of the face at the moment. Before I actually start the treatment, I want to make sure that I have good contact with the treatment zone. And you can see that I'm pressing a little bit and I'm holding my applicator perpendicular to skin. Okay, because what happens normally is, especially on the chin area, when talking about this area, about this zone, if I'm not checking it, if I'm not making sure, this is what happens. Okay, and I don't know if you can see that, but now I don't have good enough contact. My finger can actually go underneath the applicator in between the chin and and this is something I don't want. So I'm going to keep it perpendicular. Okay, you don't really see it now. I'm keeping it perpendicular, and that way I'm making sure that I have good enough contact. So once I have the movements good and easy access on my patient's skin, I can press ready and start the treatment. In order to start the treatment, I always have my applicator on the face. Okay, and once I press the foot switch, the pedal, then RF starts, the system starts to deliver RF. Okay, I will not be able to show it now. Maybe I will show it on I would have done it on myself, but yeah, maybe because I do kind of want you to hear. So these are the movements on the facial areas. Okay, areas to watch when you're treating the face are, first of all, the chin on this treatment zone. I'll give, as I said, I will give 10 minutes, at least 10 minutes per zone. So 10 minutes here, 10 minutes there. So on zone 1, focus on chin, make sure not to lose contact. Zone 2, the zygomatic arch is the problematic area. You want to make sure that you're kept perpendicular and slightly pressing against the skin in order to keep full contact. Another thing to consider here is a situation in which the patient becomes uncomfortable. So in this situation, there are a few things that I do before I change anything on the screen, okay? So the first thing I will do, I will start moving a little bit faster, okay? If my patient complains it's too hot, I want to make sure I want to press it, make sure that I have good contact, and make faster movements over the treatment zone. That's the first thing. Second thing I do is I would enlarge the treatment zone a little bit. So if that was my predefined area and patient complains that it gets too hot, then I would enlarge it slightly, okay? I would take some more skin and make sure that, that they're feeling okay. After these two are done and patient is still complaining, which they normally won't, then I would try and reduce the power, okay? Not the cuff temperature, but the power. So I've increased the speed of my movement. I've enlarged the treatment area. I have decreased the power. And only after doing these three and patient is still complaining, which never happens, I will reduce the cuff temperature. Okay, so these are my tips for correct work. You've asked if there's a specific way to be working, to be moving about the treatment area. So generally, this is, I want it to be comfortable for the patient. Normally, at the beginning of the treatment, what I do is I move slower because I wanna hit up the tissue faster. And as I progress during the treatment, okay, this would be normally a beginning of the treatment kind of thing. I wanna focus on areas more deeply in order to increase the skin temperature faster. But once I'm there, then I can start moving slightly faster, and it's nicer for my patient and for me. Okay, so this is, it doesn't matter for all I care, you can do this or that. Okay, it makes no difference as long as you're applying the applicator perpendicular, slightly pressed, maintaining full contact, and your patient is comfortable and you're comfortable. These are the things that you have to make sure. I think that's about it with the forma. We can now clean up our patients. Let's see if we have some questions about the forma before we move on to the plus applicator. Okay, just a second. Here, something came up. Can stamping technique be used to raise it? No, please don't use stamping technique. Stamping is not the right way to go with this applicator, okay? Constantly move the applicator. You can move it slower. Do not stamp. Can't see. I'm hoping that was solved. It's left, okay. For grade gynecomastia, for grade 1 gynecomastia or lipomastia, can it be treated with forma? I think you'd rather use the plus applicator that penetrates deeper and may have an effect on subcutaneous fat layer. Alternatively, use the body effects that actually does target fat cells and breaks them down for gynecomastia and lipomastia. Okay. Any specific movement we've answered. What is the recommended area size for forma plus? So it's a good question, but for plus, you mean? Okay, so for plus, we talked about two different sizes, recommended sizes. The smaller one would be 8 on 8 centimeters, and the larger one would be 12 on 12. So depending on the area. Can superficial scar get reduced by forma such as box scar or toothpick scar? Not really. No. To treat those, you would have to choose the forma and the Fractora or Morpheus. This would give you very good results. The forma is not the applicator to go in order to treat this kind of scarring. Okay. Okay. So I will now clean up my patient and my applicator and move on to the plus. finish it up later on with your permission. But what I do want to make sure is that I clean up my applicator. Okay, so this is something I always like to demonstrate as well, because it is very, very important that I keep it clean. I want to make sure I remove all gel leftovers. I don't want them to dry up on my applicator. Oh, what I think I'm missing, but I'm not sure. To start treatment, it should be on ready mode, and I press the pedal. Did I say that? I don't know. I clean it. I wipe it off from all gel, and then I use gauze with alcohol and clean it up, disinfect it, and make sure it is ready for the next week. Normally, when working on body areas, I'm already starting to talk about the class now. So normally when working on body areas, I would want to mark the treatment zone on a standing patient. So I would want to mark the treatment zone on a standing patient, and the reason is I want to normally people are walking around standing, okay? So they're not happy about something in their body. It's when they're standing up. So they show me what is wrong or what disturbs them, and I can actually target it when standing up, and then I make my adjustment on my patient when they're lying down. Since it is she's quite heavy, that one, and it is impossible for us to ask her to stand up, I will yeah, I will mark the, well, I'm not going to mark them again for the same reason I didn't mark the face. I don't want to leave any scarring and all, but yeah. Also, now we're going to have to try and do photography maneuvers, because I don't want to be with my back to you. So, so we talked about the treatment, the size of a treatment area for body, and I said the smaller area for body would be 8 on 8 centimeters, and the larger treatment size would be 12 on 12. And yeah, here, and normally what I do is I actually mark the treatment zone with the ruler and a marker or a makeup pencil or something like that. Okay, but today we're just going to I shouldn't marker, right? Yeah. No, really, just a second. So I got an approval to mark, Lisa. So what I do is I just measure the treatment area. Let's pretend that the navel is the treatment area. Okay, I'm going to treat this area. I'm going to measure it, and since it's relatively small, then I'm going to demonstrate one treatment zone of 12 on 12. Okay, so that's 12 centimeters. It doesn't have to be super accurate. So for all I care, that would be about it. Doesn't matter if I have 1 centimeter more or less, but it should be about this size. Okay, so I actually use a ruler. I do measure it, and I make sure that I'm not working on too large areas in order to avoid possibility of temperatures not rising properly. So I will now go back to main menu, disconnect the format and connect the plus applicator. And now when working with the class, I will actually give you the back, at least the back cupping sound, because we cannot actually heat up the tissue here because there aren't any tissue on the silicone, and we're not treating silicone yet. So now I'm going to have to change to plus applicator. Wait. Bear with us. Okay. Okay, so I've changed, I'm going to change it to plus. I'm going to switch it to 40. And 43 as before, and repeat. Okay. As before, I'm going to apply the gel directly on the treatment area. And I'm going to spread it around. You can either use a spatula, a wooden spatula, or you can use the applicator. Personally, I like using the applicator. So I'm going to spread the gel around. Again, if you think you're going to have to use some more gel during the treatment, you can apply a little bit of reservoir on the sides and the adjacent area. And let's listen to the sound, the back coupling sound. Okay, so if I'm moving to ready mode, switching to ready mode on the screen and pressing the pedal, then what I get is that sound. Okay. Alternatively, if I actually apply it to skin, I would get a different sound. And it will sound like this. I will try and demonstrate. Okay, we're going to use a hand here that was unwittingly volunteered. So what I want you to hear is the signaling of the system. Okay, I want you to hear the beeping every second and then the temperature rising. Okay, so to start the treatment, I make sure that I have good contact. I press a little bit. Once I feel like I'm ready and I have good contact, I'm pressing the pedal. Now you can listen to the beeping sound. I will increase the size of the treatment area in order to increase the temperature faster. And then we go back to listen. You can stay. It's nice, huh? Nice. It's nice. That was too hot. Because I want to increase the temperature faster. Now, what happens if I accidentally lose contact with the skin? Okay, so this is a good demonstration. What I want to make sure is that if I have to stop the treatment, and this is true for face and body treatment, if I need to stop treatment, I first, while moving the handpiece, I remove my foot off the foot switch, and then I remove the handpiece, okay? So this is the idea. Is it possible to actually show that, to actually demonstrate the increasing of the temperature? Sorry, but let's go back to our patient here, and I will not actually give her a treatment, but give you the tips, okay? So especially working on such a defined area like here, it is very, very important that you're making sure that you're not working in the exact same direction, okay? So I would not want to work this way and then go back in the exact same area, because this is already heated up and this is kind of cooling down. So what I would want to do is cover it in a more even way, sort of say, okay? So I would want to do something like that, and then back to the first area, and make sure my entire treatment area is covered again and again and again. And I remind you, if patient is complaining of a too hot sensation for some reason, there are things to do before I reduce the cutoff temperature. So first, I move faster. Second, I enlarge the treatment zone. Third, I will reduce the power, and only then I would actually reduce the cutoff temperature. Any questions about the plus applicator? No questions.
What about the plus?
No.
This one?
Huh?
Did you answer this one about surgical scar?
Surgical scar? No, where is it?
On the gray one.
Can superficial scar? Ah, can. I have answered. No, I recommend you using Fractora or Morpheus. Okay, so I'm just going to clean up my patient, clean up my applicator, and we're going to continue with body effects and mini effects. Okay? Okay. So I just want to make sure that the applicator is clean, and then we can continue with our webinar. Okay, forgive me. As I said, this is something I like to do immediately after. I don't like postponing it because then you tend to forget. So alcohol, make sure you remove all gel, and yeah. Okay. So let's move on with our presentation. So I see there was a question here. Thyroid cyst, contraindication for face. First of all, with regards to contraindication, you have a full list of the contraindication on the operating manual, and I urge you to read it. Okay. Second, a cyst that does not causes any unbalanced hormonal situation on the body. I would not treat immediately over the cyst, but I would treat. It is possible to treat the face. Okay, if the hormonal situation is balanced, no problem. Will it deliver more energy as the cutoff fast? Sorry, I don't understand. Will it not deliver more energy as the cutoff fast? Cutoff fast. Energy is delivered as soon as long as the cutoff temperature is not reached. Energy is delivered. Okay, so that's not a problem. We always want to work at almost the cutoff temperature. What about
treating the upper part of the breast? We have a question.
Not a problem. As long as there are no implants, silicone implants, or other type of implants that we're not aware of, not a problem. You can treat the breast. You can actually also see. Let's switch cameras again. You can actually also see some before and afters. Okay, we had, I think, we had a picture of a mini breast lift. Okay. Huh? Oh, you don't see the screen. Sorry. So here you can actually see a before and after with a mini facelift that you can use the plus applicator for. Okay, smaller breasts, you might want to consider using the Forma instead of the plus. I think we're good with questions. Let's move on to the body effects and mini effects. So body effects and mini effects are aimed for body contouring and cellulite treatment. Generally speaking, we're combining mechanical vacuum, skin massaging, non-thermal and thermal RF energy for the treatment of temporary reduction in appearance of cellulite and temporary improvement of circumference and body contouring. Yeah. how does it work? So first of all, vacuum is applied. Suction is coupled with basic RF, meaning there will not be any RF emission if vacuum is not created efficiently enough. Okay, so first there is the vacuum that sucks in the tissue and enables work on deeper planes. And only once established good vacuum, RF will be delivered. Okay, and then the RF will flow in between those two electrodes, bipolar we said. Okay, so we're controlling the temperature in a similar manner to that we controlled with the forma and the plus. We have a temperature sensor embedded within the applicator, not so much in the electrode as before, but deeper in the electrode that actually monitors the skin temperature over this part. Okay, and the RF flows alternating current from one end to the next, back and forth, constantly heating up the tissue to the cutoff temperature that we've chose initially. Okay, and unlike the forma and the plus that are working continuously, here we're working in a more pulsating manner. Okay, so it is not a continuous work for 10 or more minutes, but we're working pulse by pulse. A pulse can last for anything in between 2 to 7 seconds, depending on your decision. Okay, so you decide how long is the pulse, but whatever you decide, at the end of every pulse, you get a high voltage, super short, ultra short pulse of RF. And this nanosecond pulse, this high voltage nanosecond pulse, actually causes electroporation. Now let's talk very, very briefly on that electroporation. Okay, so we said ultra short pulse with very, very high voltage that causes this. What actually is applying an electrical field across the adipocyte cell membrane. Okay, so as you know, or if you don't know, each cell of the body is kind of encapsulated in a phospholipid bilayer that maintains its integrity, and there's only a very limited list of substances that can penetrate and how it can penetrate. So most substances in the body, if they can go through the membrane, it's only via very specific channels that have to have a specific ligand, and they're all very, very specific pathways in the body to enable a substance to pass from outside the cell toward inside of the cell, or the other way around. The most obvious and well understood example is sugar and insulin. Okay, so insulin is the one that the body releases insulin to enable sugar to let it into the cells. Okay, so the insulin has to bind a certain receptor in order to let sugar enter the cell. But there's always, for each substance, there is a cascade of events that has to occur for it to enter the cell or to exit the cell. But when applying that ultra short pulse, high voltage pulse, we're applying an electrical field that changes the permeability of the membrane. Once permeability is changed, actually other substances that would not normally be able to go through that membrane are able to go through it. So what we get is a leaky membrane, and this actually is irreversible damage. Okay, so irreversible electroporation. This in turn leads to apoptosis. And apoptosis, if you know or if you don't know, is the right way for a cell to die. Okay, so there are two ways for cells in the body to die. One is necrosis, which is not controlled, and apoptosis, which is controlled. So programmable cell death. Cells are signaling the immune system to start working in order to evacuate all the debris. Okay, so this is done very, very monitored by the body, so it's safe for the body. we're kind of triggering not a physiological condition, but we're triggering a physiological preference of cell death. Oh yeah, let's move on. So what does the thermal effect does? We're heating up the adipose tissue that increases the metabolic rate. Also, it lowers the threshold for that irreversible electroporation and makes it easier. So we talked about what that electroporation does. And the reason, what we haven't said maybe is that the fact that it's very, very high voltage enables us to target only the largest cells, okay, and not any other cells in the body. So it is specific to fat cells, to adipocytes, which are significantly larger than any other cell of the body. And here is this is actually a study done, and it shows the selective damage given to the subdermal fat layer by that high voltage nanosecond pulse. Okay, so on the left side, what you see is untouched adipose tissue, and you see nice rounded cells. You see the nuclei on the sides, the purplish ones here. Okay, and on the right side, it's also, what you should know is it's a specific stain for apoptosis, and we'll see it later on the next slide. We'll see it slightly better. What you see here, the membranes are distorted, the cells are not rounded and filled with fats, and these are cells that they will try to fix themselves up, but not necessarily succeed. Okay, and once an apoptotic pathway or signaling has started, there's no way to stop it. So it will only go one way. And again, and you see, we're talking about specific staining for apoptosis, and you see that higher markers. Okay, on the left side, there's no apoptotic occurrences, and here after 6 treatments, you see that we can actually locate cells that undergo or will undergo apoptosis. And here's what actually happens within the cells. Okay, so immediately after body effects is applied, the dermis is heated up. We have attenuated vertical fibril septa and the electroporation that damages adipocytes in a selective manner. This apoptosis pathway starts that causes some that causes, basically it will shrink up the size of the adipose tissue. Okay, and eventually after body effects treatment, what we see, because we also have an effect on the dermal and on the epidermis and dermis, right? Because we're talking about RF, to the same extent we've heated up the tissue with the plasts and the forma, we have an effect on the dermal tissue as well, on the fibroblasts and collagen and elastin. So we will work on that layer as well. So we have a thicker dermal layer that is composed of new collagen and elastin fibers and hyaluronic acid. We have that immediately affects the appearance of the epidermis, and we have a remodeled fibrosepta and fat layer, and thinner fat layer as well. Okay, effects on cellulite are also shown, mainly due to the effect on the fat layer and the fibrosepta. Okay, so deeper dermis also helps us a thicker dermis also helps us to kind of avoid the more orange skin-like, orange peel-like skin appearance, and more directional fat septa actually gives better support, so you don't have that sinking and bulging out, and that way we are actually able to fight that cellulite appearance. Another study is done showing atrial circumference reduction in a real life patient. Okay, I don't want to take too much time on that. It's very clear. We're applying the applicator for 6 weeks and we get good results. Here again, 6 months after a series of 6 sessions, you see quite significant results. This is really, really nice. This is an electron microscopy. It's actual fat cells. So electron microscopy is really, really nice because it actually shows what happens to the cells. So it's not just what happens to the entire structure or a demonstration, a computerized demonstration, but it shows what happens to the cells. So here on the right side, you see a normal adipocyte that is rounded and flat and smooth kind of thing. And here what you see is a fat cell that was damaged by the high voltage RF, and you see the damage to the membrane, okay? And this is something that the cell, this pedicle here, this is the body is trying to fix that damage. Now, if it's small enough, if the rupture here is small enough and the damage here is small enough, cell body might overcome that damage. But when creating a more significant damage, then this pedicle would not suffice, and this cell would undergo, for example, something like that. These are cells that soon signal will start the cascade of apoptosis. Okay. You can actually see a ruptured membrane, and yes, of course, this one, there's no doubt, will further progress the process. Okay, so pre-treatment considerations, very similar. Clean skin, make sure to read through the contraindication, patient signing an informed consent form that no suffering from any contraindication. Patients on anticoagulants, blood thinners, any issues with bleeding disorders, we have a slight problem. Okay, make sure if they can stop the anticoagulants or blood thinners prior to treatment, do that if their doctor's allowing that. If not, then you might want to avoid the treatment because the suction, the vacuum is quite significant and it may cause some bruises, and we want to avoid that. Okay, before and after pictures, realistic expectations. Explain your patient that we're treating a localized area. Okay, so it's not about that we're going to solve their entire eating disorders issues using these applicators. But if a patient is not happy about her cellulite appearance or her inner thigh or just the submental area or just a little bit of bulging tummy, whatever, something like that can be treated. So we're not treating an overall oversized patient. And we want to mark the treatment zones into areas. Now it's 2 to 4, it's actually a mistake here, I kind of missed it, sorry. So it's 2 to 4 times the applicator size for mini FX and 4 to 6 times the applicator size for body FX. Now, I know for Forma and Plus, we talked about facial treatments and body treatments. For body effects and mini effects, we're only talking body treatments, okay? It is not aimed to treat the face at all. The only area that we're, the highest area that we're targeting is the submental area, submental fat here, not more than that, okay? The idea of the mini effects is to be able to target smaller body areas, like this area, like the arms, like above the knees, stuff like that, okay? Not facial treatments. I stress that out. Okay. Yeah, as we said, read that, make sure that your patient's not suffering, any of them, and the treatment. So this is the treatment screen. As always, very simple, very straightforward. In this case, the system recognizes the tip, the handpiece, so you don't have to worry about that. That's one less thing to worry about. Power, in this case, I think around 40, but I'm slightly more careful here because it is not as easy tolerated as the Forma and the Plus, and I will give you a set of recommendations in the next slide or so. Cutoff temperature, again, because it's not as tolerable as other treatments, I recommend it not higher than 42. You may start at 40 and increase it gradually to a tolerable temperature, okay? Pulse, we've talked about before, can be set to anything between 2 to 7 seconds. And I think a good standard is anything on between 3 to 4 is normally tolerated by most patients. And in any case, when you have something that has to be said about the pulses and how the treatment is being conducted actually, is that in any case the system reads the cutoff temperature has been achieved, then the pulse will be stopped before it ends. So even if I have a pulse of 7 seconds and after 3 seconds I've already reached the cutoff temperature, then the system will stop the pulse of the RF and will only give, and at this point will give the high voltage nanosecond pulse, and then I can move on to the next area. Okay, so the same mechanism of safety works here with regards to cutoff temperature. So once I got to the cutoff temperature, RF stops, I have the high voltage pulse, and I can move on to the next place. Here is the set of recommendation. Again, not gonna read through it. Temperature should be set to as high as tolerable. In my opinion, not higher than 42. And RF power, something between 35 to 40 is normally good enough for everybody. Of course, for mini effects, you're gonna have to use slightly lower parameters, more sensitive areas, so more sensitive with the settings. Okay, unlike the Forma and the Plus, in this case, we are not allowed to use any gel, any lotions, any oil-based, anything. Why? Because we have suction, we have vacuum applied here, okay? So if you're gonna use gel or anything like that, you will damage your applicator. So avoid that completely. As we said, we're dividing the treatment area into zones. So 4 to 6 times the size of the vacuum chamber for body effects, 2 to 4 for mini effects. We're assuming good contact with the skin of the applicator with the skin, and then pressing the pedal. Once vacuum is achieved, then RF will be automatically emitted. Okay, we've talked about it. We want to make sure that we are overlapping slightly just to avoid applying the electrodes on the exact same spot again and again. And then we're just repeating the passes until the cutoff temperature is achieved, and then we're going to continue the treatment for another 10 or 15 minutes, depending on the patient's ability to tolerate the treatment. Okay? Yes. Again, here are a set of recommendations of parameters. Okay, so anything between I would say start at 40. That's a good recommendation. And you can increase it from there slowly. We kind of covered that already, so yeah. And this is for the mini effects. So for mini effects, we kind of divide it in more specific ways: neck, arms, and knees. Neck is should use slightly lower parameters, on arms slightly higher, on the knees, which is more resistant, you can use slightly higher energy settings. The cutoff temperature should always be set at around 40 to 42, okay? And pulse width, again, around 2 to 3 is tolerable with the mini effects. For better results, again, don't shorten the treatment too much. So a minimum treatment of 10 minutes or longer if possible and tolerable by your patient. We're talking about a series of 6 sessions, 6 weekly sessions in a similar manner to what we've talked about with the Plus and the body and the Forma. So 1 session per week, 6 weeks or more if you think needed. And if you can perform mega sessions, then you can lower the number of sessions to 3. Normally with the body effects, I don't recommend it as much as I do with the Plus and Forma, okay? Just because the treatments are not nice on your patient. 1 maintenance treatment every 3 to 6 months, depending on your patient age, needs, etc. Post-treatment, don't cool down the skin. We may see petechia, bruising, redness, some purpura may be seen as well, and it's not written here. We want to avoid hot tubs and jacuzzis on the 2 days follow the treatment. avoid scrubbing and scratching the treatment area. Moisturizing the skin is possible, and of course cleaning up the applicator post treatment. And a little bit of before and afters. Let's go through that as well. Okay, so the good results are showing again and again for different body areas and different indications like circumference reduction and cellulite appearance. And I will take, with your permission, like 2 minutes break, and we'll be back with you in 2 minutes. Okay, so I'm just gonna run quickly and be back with you in 2 minutes. Okay, excuse me. Okay, did you time me? Was it 2 minutes or did I take more of your time? Sorry for that. Okay, yes, what we have next is just our hands-on part for the body effects, and let's see some questions about the body effects first. None? Great. So let's do a little bit of hands-on part. We will start with the body effects, and then we will move on to the mini effects, hopefully, because normally for the mini effects, I like to ask my patient to sit up because I'm treating the submental area and I want gravity to work. But the problem is Lisa is quite heavy and I'm not sure we can sit her up on ourselves, but we will try. So let's start with the body effects. Screen is not needed. Okay, so I think what you see now is just Lisa, perfect. Okay, so as we said before, we're not we're not using any gels or lotions or anything like that. It's actually super important that you don't, because if you do, then you may ruin you will ruin your applicator. Okay, so don't use that. Well, again, what we're missing on these settings is the fact that I cannot show you the connectors, the different connectors, and how to work with them. But the Plus and Forma has one type of connector, and the Body Effects and Mini Effects have a different type of connectors, and it means that both technologies can be connected at the same time. Okay, so but it's not to say that both of Body Effects and Mini Effects can be connected at the same time. So now I have the Body Effects connected. I see that I did not clean my patient good enough after the Plus treatment. But let's start with the screen. Okay, so I'm going to choose Body Effects, Mini Effects. Slowly. It's not very well shown, but I'm pressing once, it enters the screen, and what I do want you to see is that it recognizes the handpiece, but you don't see it, okay? So you're gonna have to play with your system. Leave it, okay? Just connect it, and you see that you don't have to choose, you don't have to choose the right applicator, but it actually recognizes it alone, okay? What we do have to choose from, and again, you have it in your presentation, you have it on your QRGs, you have it in the operating manual, the power, the cutoff, and the pulse duration. Okay, so the power, as we said, should be anything between 35 to 40. It is not as tolerable as the Plus, so for now, let's say 40. Cutoff temperature, I never start with 43 with the case of Body Effects and Mini Effects. I would start around 41, 41.5, and increase if possible with my patient, okay? Pulse duration, the easiest for me is to start with the pulse duration of 4, and then on the first two passes, first 2 or 3 passes, what I do is I give double pulse. I will show it to you immediately. And these are all the settings. Again, I have the temperature measurements, the online temperature measurement, the temperature sensor in this case is embedded here in the applicator and not in the electrodes. Okay. Once I apply my finger onto that sensor, it reads it and changes it automatically. Okay, and this also gives me an indication that the sensor is working and it's safe for me. Additionally, the Body Effects and Mini Effects also have a screen showing on the back of the handpiece. There is a screen, not in this handpiece case, but your applicator will be brand new from the box and will show it perfectly well. It shows the temperature as well. Also, we have the same signaling, the same beeping sounds that we've heard earlier, okay? So if you don't get good enough contact, you have the sound indicating that at the phase of rising temperature, you have 1 beep per second, then 2 Celsius degrees below the cutoff temperature, you get twice per second, 2 beeps per second, and then at the cutoff temperature, 3 full beeps per second. We talked about the fact that we are marking our patients on a standing patient, which I will not demonstrate now, so you'll have to forgive me. And we've talked about the size of the treatment area. Okay, so the size of the treatment area, as we said earlier, we're talking about 4 to 6 times the size of the chamber. I don't want to turn my back to you again, so I will try my best. Okay, so try to ignore the marking of the plus. I will re-mark a treatment area for the body. Okay. So the size of the chamber is about 3 on 7 centimeters, so about 21 centimeters square. So it doesn't really matter if you're going to have the treatment like this or like this. I can actually use very, very similar, I can use the same grid because 21 centimeter multiplied by 6 is 120. And here we have a little bit more because it's 12 on 12, so it's 144 centimeters square, right? I'm hoping my math is right. So that's estimate. Slightly, needs slightly smaller, but I just like to work on a straight line. Okay, so I kind of take this area. So we have 3 multiplied by 6 is 18. 6 times chamber, and then 7 centimeters. Too smaller patient. And again, it doesn't have to be 100% accurate. I just want to make sure that I'm not working on an area that is too large. Okay, so this would be the area. This is 6 times the chamber size. Okay, and after my my parameters are set, I press on the standby button, switch to ready mode, and I apply the applicator like this. And then I press the pedal. Okay, once I press the pedal, system will start the vacuum. But until I establish good enough vacuum, I will actually not have RF. And this is a very, very good demonstration. The only way I will actually have RF is when assuming vacuum. So that would not be possible for me to show today, because it's also not possible to show in the arms. It's not fatty enough, so I will not volunteer that unhappy arm that we saw before. So the idea is I'm just going to give 4 seconds pulse, and as I started talking about that before. So we talked about double pulses on the first 2 passes, just in order to increase the temperature faster. Okay, so I will go 1, 2, 3. The pulse will end. It will give a high voltage pulse, and I release the pedal and press it again. Okay, so 1, 2, 3, 4, and that high voltage pulse, and then move on. And we talked about a minimal overlapping of 10 to 20%, and again 2 pulses of 4 seconds, and again 2 pulses of 4 seconds, again 2 pulses of 4 seconds, and again. Another thing I like to do during this treatment is to change the direction of my applicator. So one time I go like this, and the other one I go like this. It gives me good area coverage and also prevents overlapping of the electrodes on the same area again and again and again. It's nicer on the patient, helps them experience the treatment as more tolerable. And unfortunately, this is it. So because we're not able to actually apply RF onto that patient. Now I see you did ask some questions. So before moving on to mini effects, let's see these questions. Okay. It's okay. I'm not familiar enough with Vela shape, so I won't be able to answer this. But yeah, please ask that question on the survey after the webinar, and we do have our marketing department do have a comparison in between. So if you ask it, Valentina, it's your question, okay? If you ask that question over the survey, we will send you the details that we do have. What is the difference with, so it's the same question. So again, just write that down on the survey form. We have a glitch on the camera. Sorry, this is, yeah, that's what we have. These are the technical conditions that we're working under. Okay, so let's move on to the body effects. Let's try. The mini effects, sorry. So we'll need your help sitting her up. That's left. Okay, we did it. Okay, so you can comfortably restart. Okay, and we want to make sure we have good access to this area. Okay, sorry, I'm sure that wasn't looking very good over the web, but we have a sitting patient now, and this is very important for us because, as we said, we want to work with the mini effects. So I'm just gonna go back to main menu, disconnect the body effects, connect the mini effects, and adjust parameters and demonstrate the treatments of the submental area. Okay, so we have the mini effects connected now. The screen looks exactly the same. Only difference is that it says mini effects, and since you couldn't see that anyways, then no need. So we talked about the submental area. Submental area, we recommended the power of 10 for it to be tolerable by the patient, and you can see it on your presentation. You can see it on the QRG as well. Okay, I would start with 40, 41. Okay, something like that, and a pause of 2 seconds. And again, switching to ready mode. And once I'm ready, I'm applying it like this. So what I want to do is I want to use gravity. Okay, I want to let gravity do its thing, because normally people with double chin or something like that would actually show it best when sitting and not lying down. Okay, so that's what I want to do, and I kind of press against the skin, and that enables me to work on the tissue that I'm looking to target. Okay, so I do that, and I cover the treatment area, and it should be smaller, so it's 2 to 4 times the size of the applicator. Okay, so how long? Again, we're talking about a minimum of 10 to 15 minutes over treatment area. Same goes for arms. Okay, now it is impossible to ask a patient to hold their arms like this for. It is possible to ask a real-life patient to hold their arms like this for real treatment for 10 minutes, okay? So what I do is I mark the treatment zone when patient is positioned that way, and then I have them lay back and adjust, and then treat that that area after I mark it like this, because that's where they would want to fit, right? So I want to carefully mark it and then have them lay back. I hope that was clear. And I think we're done. Let me just check if we have any questions regarding this technology. With VelaShape, it is recommended to use gliding technique purely because they use a cream in order to achieve a good coupling, and because they use an infrared technology. Okay, so with that said, actually, thank you, Javier. As I said, I'm not familiar with enough with VelaShape. Definitely not gliding here. We have vacuum, so it's not possible to glide anything. What you want to do is just follow the treatment recommendations that I gave you. So, okay. So, thank you again, everybody, for staying with us today and joining us today. It is a pleasure to be with you at these crazy times. And we'll see you again tomorrow, next week. Tomorrow, not tomorrow, next week. Sorry, next week. I think it's Tuesday morning. early morning for the European fellows. For the Far East is midday, so a little bit more comfortable for you and not so late for Australia. And we will cover the Evolve and Evolve, the hands-free brand new systems that we have, which are super, super cool and super important. And we're really excited about them. And yeah, see you again next week. Bye-bye.
Bye-bye.